Is President Trump going to die of coronavirus? I'm going to give you my best answer at this in a minute. And I want to discuss, I'm Dr. Larry Burchett, MD. I just watched Dr. Sean Conley, the president's personal physician today, Sunday, October 4th, 2020, update us on the president's condition. I'm going to tell you what I think about that and explain, number one, why oxygen is so important, why the press has been focusing on that, the president's oxygen level. Number two, how you can tell if the president is doing well or not. I want to talk about his treatments, what he's got, and what we can expect going forward. Let's talk about oxygen, his oxygen saturation. The press has made a big deal about it, and rightly so. With COVID, it's a big deal. I'm an ER doctor. The number one thing that I've used to figure out, does somebody need to stay in the hospital or can they safely go home if they've been diagnosed with coronavirus, looks like they've got COVID, is what is their oxygen saturation? We measure that by putting a probe on the finger and checking. And a normal oxygen saturation, probably in you and me, 98, 99, 100%. That's normal. If somebody had smoker's lungs and smoked for 60 years, their oxygen level might be normal at 88 or 86, but they're gonna feel short of breath. Under 90, I think everybody would, all doctors would agree, if somebody had COVID and their oxygen level dropped below 90, that they should stay in the hospital, get oxygen, like this. When you get that tube, nasal cannula, we call that. Under 90, you need to stay in the hospital and be treated for coronavirus, not only with oxygen, because you're going to be short of breath, but then that's also a threshold, 90, 92, where we start giving medications like steroids like dexamethasone, remdesivir, maybe convalescent plasma. When people are sick with COVID, that oxygen level is really the primary thing that we're looking at. There are other things, what their lungs look like, do they have complications like kidney failure or clots, dehydration, etc. There's other things that matter too, but this oxygen level is number one. And so what happened with President Trump, again, according to his doctor today, Conley kind of finally told us some things that he didn't tell us at the previous press conference, was the president's oxygen level dropped at the White House to 93 or 94. Now, for the average person, again, I'm an ER doctor and I've seen tons of people with COVID. If they're COVID positive and they look good, they don't have other complications, they're a person who is 30 years old without any medical problems, and their oxygen level is 96 or 98 or 99, they can go home safely, quarantine, take care of themselves at home, drink plenty of fluids, all of that kind of stuff. They don't need to stay in the hospital. But once the oxygen level starts dropping, then you start thinking, is this person getting sicker and do they need to stay in the hospital? And so when Trump's oxygen level in the White House, Dr. Conley told us this, dropped to 93, 94, that's when they pulled the trigger and said, we need to watch him. We're worried he may be getting sicker. And at that time, that was a red flag. I mean, that would worry me. Oh man, because he doesn't have any lung disease. He doesn't smoke, doesn't have any history of emphysema that we know. He's not short of breath when he's speaking or walking around. I think his oxygen level probably normally is 98, 99, 100. So that it went down does have some significance. He needs further evaluation. What I tell people when they go home is the number one symptom I'm worried about is shortness of breath. If you've got coronavirus and you go home and you get short of breath, you need to come back and be evaluated, meaning have this put on your finger, get a full exam, get blood work, an x-ray, check your heart, all of this stuff. So they sent him over to Walter Reed, did all the tests, had him monitored. He may have been on oxygen for a little bit. Do you need oxygen at 93 or 94%? If you're short of breath, but it's not necessary. So they probably put him on it for a little bit. He's like, it doesn't help me feel better. I don't need this. I'm sure he didn't want to wear it. And then, we get the news also that his oxygen level now is 98%. So it's improved. It's gotten better. Went down to 93, 94. When that happens, we're basically waiting to see, sure, he gets treatment, give him oxygen, but you're waiting to see, is it going to continue to go down? If he's in the 80s and 70s and you can't give him enough oxygen, whether it's via a little tube or a mask, then you would have to intubate him. So that it went down to 93, 94, that was worrisome for sure. And it sounds like that was Thursday. And then Friday, he got better. And then you see this video of Trump yesterday. I did. And when I saw the video of him, he's sitting there at the desk. His color looks good. I know he tans, but still, he didn't look pale. He wasn't breathing fast. He didn't look sick. He looked pretty good. He looked like somebody that I think if he weren't the president would be at home, not in the hospital, being monitored and treated for coronavirus. Of course, this is the president of the United States. They're going to take extreme precautions to make sure that he's okay. But as through my doctor eyes, seeing him in that video talking, I was like, he's not sick. I'm not worried right now. Based on his current condition, I think he's fine and he could probably be in the White House, to be honest, assuming that they can still give him whatever medication they're going to give, remdesivir, et cetera, and I think they can. Dr. Conley talked about Trump possibly even being discharged Monday, tomorrow, to go back to the White House. I think that's what's going to happen. To get back to my question, do I think Trump's going to die of coronavirus? I don't. Now, is he 100% cleared? No, he's not. Typically, when people get a fever and body aches and the flu-like illness, they have that for a period of days, maybe a week, and then they get worse. And often that suddenly goes down. Now, it's a good sign. There's a couple things that are a good sign. His oxygen level's gotten better. His symptoms are reported to have gone away. So he had fever, fatigue. He did report some fatigue, nasal congestion, a cough. So he did have some symptoms. Those are reported to have gone away. Now, if that's true, that's also, I think, aids in arguing that he's got a better prognosis, a good prognosis. Typically, in my experience, again, people can get sick within a day or two and just go from symptoms. But most people were kind of sick with a flu-like thing for a week, and they looked worse than he did. They just looked terrible. They're just like run down and kind of punky and just, not on death's door, but they just didn't look sick. They looked like they had the flu and were miserable. And then day 7 or day 10 or whenever it hits, kind of after about a week, boom, oxygen level just goes down fast and they get sick in a hurry. So could that still happen to Trump? It could, but it's just less likely, I think, based on what we've seen and heard. His oxygen levels getting better. And remember, he is 74 and a male. Both of those are risk factors for worse outcomes for coronavirus. And 3, he's obese. He has some degree of obesity, whether it's overweight or mildly obese, whatever. All of those are risk factors. He does not, again, according to Conley in his briefings, he doesn't have high blood pressure or diabetes. These are 2 big things that often cause complications. Again, reflecting on my own experience and looking, at the data, I think Trump's probably going to do fine. No promises. There always can be complications. Things can happen. But the people that I've seen that have gotten into trouble, they are obese, but they're more obese than him. They have diabetes, high blood pressure, and they're not well controlled. Again, some healthy people get this, but overall, it's people that are in worse condition than he is. I think he's probably going to be fine, meaning less than 1 to 5% chance that he gets in trouble and has to go back to the hospital and ultimately dies. Now, could he have a complication of a clot in his lungs or brain or these kind of long-term things that we're finding out happen? Sure, he could have any of that, absolutely. But chances are he's going to be fine. Let's talk about his treatments a little bit. A little bit of controversy around this, right? So this is not medicine for the average American. This is a medicine for the president of the United States. Number one, he got a medication that is absolutely experimental at this point called Regeneron. And it's where they take an antibody. You know what antibodies are. They bind to the virus and prevent it from getting into the body. The immune system responds. It's basically antibodies made in a lab and also kind of cloned from people who have survived from coronavirus. That was this cocktail that he got. You give them these antibodies, that thing's called Regeneron. It's not FDA approved. maybe there'll be some benefit, but it's really experimental. I haven't seen any of my patients get that, as opposed to everybody that gets admitted to the hospital these days gets two things for sure: Decadron or dexamethasone, the steroid, and remdesivir. And Trump has had both of those. I'm going to talk about that in a second. Everybody gets that. I haven't had anybody get Regeneron. Totally experimental. His doctors thought that it was worth it. In this case, they got an emergency use, compassionate use of this. That's controversial. I don't know that I would have given that to him, to be honest. I'm not sure. The way that I look at these things, I usually sit back and want there to be more evidence, more convincing evidence that it is safe and that it is effective. It's just so experimental at this point, but this is the precedent that they chose to do that. The other thing you have to remember is with a lot of these medications, like remdesivir or dexamethasone, they show that they do benefit somebody, but some of the studies have shown that it's only when people are super sick, meaning their oxygen level gets low, they're ICU type folks. There's not any benefit if somebody's just at home with coronavirus. And with some of these medications like steroids, there's side effects. And so dexamethasone, for example, Decadron, if you don't need to be in the hospital, if you just have coronavirus, you're okay at home, your oxygen level's not low, if you give those guys dexamethasone, it actually harms them a little bit. They do a little bit worse. So there's some data to show if you don't need to be in the hospital, we don't recommend this medication. And so that's why we don't give this to people when they go home with COVID, when they're okay and don't need to stay in the hospital. So Trump is in this place where his oxygen level dips down to 93, 94. If he were an average guy, average American, he wouldn't have stayed in the hospital for that. It's not low enough. It's not 89. Sometimes under 92, 91. If somebody's 95 years old, they're super frail, they can't walk, yeah, you're going to admit them to the hospital. Most people, probably around 90 is that number. He wasn't low enough to get that. They decided to do that based on his oxygen level going down. Again, that's going to be a little bit controversial. I'm not going to play Monday morning quarterback or anything, but I want you to know, especially if you have somebody with COVID, what the standard of care is right now with what we're doing. And most people, not the president, would not, I don't think, have gotten Decadron in that instance. Remdesivir, they decided to give him that. Again, similarly, we don't give this to people that are at home. We give it when people are sick and in the hospital. There may be some benefit to what he got. Again, it's still incredibly experimental. Okay, so what do we anticipate to have at this, what can we anticipate from here on out? Conley hinted at it. So Trump, he's up and about, he feels good, he's tweeting, right? He's better. When there was that period, I don't know how long he went without a tweet, whether it was a day or something like that. That's when I think everybody was worried that he was getting into trouble. So when he stops tweeting, we kind of joke about it, but when people aren't feeling well and they're not doing their regular activities, that's a bit of a red flag. So when I see him coming on video and starting to tweet again, I'm like, he's feeling better. He's going in the right direction. Another thing that makes me think he's not. He's going to be fine, right? He's going in the right direction. Again, he could do that, but most likely he's going to get back at it and be okay. I think he's probably going to go back to the White House tomorrow. They're going to be able to monitor him and give whatever medication. Remdesivir is a 5-day course. He's going to also have, it sounds like he's going to have a course probably of steroids as well. They can administer that at the White House. He doesn't need to be at Walter Reed anymore. Let's talk a little more about this press conference. So you saw this kind of big show of doctors. Of course, he's going to have multiple specialists weighing in on his care. Number one is a critical care pulmonary doctor. That's an internal medicine doctor, an adult doctor who has specialized basically in ICU. And lungs is kind of a common ICU specialty. He had some of those guys. So he had his regular doctor, who is kind of the quarterback. He had the pulmonary critical care guy, again, the ICU doctor, who he was the second one to speak in the press conference. And then he also had some infectious disease doctors. Again, so coronavirus is a virus. We're going to fall into the infectious disease specialty, but then also it affects the lungs primarily. So you're going to have both of these specialists weigh in on What's the right medication? What should we do? And they're, as a team come together, everybody kind of puts their heads together, weighs in, and then ultimately they make the decisions together. Of course, he's going to have, the best medicine that we have. Most people, when they get admitted to the hospital, are similarly going to have ICU specialists, infectious disease specialists. These decisions in most hospitals about what medications to give, they're often protocol. So your personal doctor can select which meds to use, but especially with this and the uncertainty, a lot of times each hospital will have, okay, if somebody's admitted to the floor, to not the ICU, this is what we give them. We give them these 5 medicines. If they go to the ICU, this is what we're doing, all of this stuff. There was some talk about proning. Conley talked at the other press conference where Trump was asking about proning. Proning is so when folks get really sick and they get put on the ventilator and they're having a machine breathe for them, we've discovered recently that if you, instead of just leaving them on their back, like this for a week or 2 weeks, if you flip them onto their belly, that enables, between aeration of the lungs, between kind of allowing all of the alveoli in the lungs to expand, patients do better. So it's one way that we've figured out a way to care for sick ICU patients without other curative, life-saving medications, something to do that benefits people when they're on the vent from coronavirus. Trump doesn't need to be proned with an oxygen level of 93, 94. That just isn't something that's done outside of the ICU. So there's, various things that make sense when somebody's in the ICU, but aren't going to be needed for Trump in this case, because really he should be treated not like a hospitalized patient. His oxygen level is 98%. He should be treated like somebody who's gone home. Now, they gave him, there's kind of a cocktail. There may be some benefit of things like vitamin D. Certainly, if you're vitamin D deficient, that would help. I think for the average person who isn't, I call it squirt gun medicine. I don't know that it makes a big difference, but knock yourself out. I think it's safe. Vitamin D, zinc, commonly given for viral infections. Famotidine, which is Pepcid, which is kind of an acid blocker, often given for reflux. He was also on that sleeping pill that's a natural sleeping pill. It's escaping my mind at the moment, of course. Melatonin. He was on melatonin as well, and an aspirin. So some of the interesting other kind of questions that I've been talking about with my colleagues. When somebody has coronavirus, they're at a slightly increased risk to have clots, like clot in your legs, lung, stroke. Would we put him on a blood thinner? If you said, no, he's going home, he doesn't need it. I don't do that with patients that get coronavirus. I don't put them on a blood thinner. You could say, well, we'll put them on a baby aspirin. That'll cover something. And then, more aggressive folks would be like, yes, we want him on a full dose blood thinner. I don't know that most people would do that, but it is a question. Would you put him on a blood thinner to try to prevent all of these clotting complications, which are so known in COVID? So I think I'm going to wrap it up. Again, based on what Trump's personal physician has said about his oxygen level going up, his symptoms going away, what we can see on camera where he looks good, I think he's going to be fine. I think you're probably going to see him go home tomorrow back to the White House. They'll continue to monitor him. They'll finish that course of those medications. He will need to be on a 14-day quarantine. So he's going to need to stay away from people for 2 weeks from, when his symptoms were onset, which certainly is incredibly relevant during, his re-election campaign. There are a lot of criticisms about questions of when did he become ill and when was that test positive? Did he continue to interact with people Knowing that, I don't know the truth of any of that stuff, but you can see a lot of people in the White House in that circle, and then it really looks like it came down to the Supreme Court nomination event that was a super spreader event. Unfortunately, folks there were not distancing and wearing masks, really displaying the public health, the risk of those kind of events. Sadly, there have been some rallies, to support President Trump, which is great. But again, distancing hasn't been observed, and neither have masks, which is ironic because they're getting together to show support for him when those preventative measures weren't taken. So there you have it. I think he's going to be fine. This will obviously continue to be a story. If you have any questions, please reach out to me on social media. Thanks for watching. And, as always, stay safe, stay sane, do your part, and I'll talk with you next time.